What is abnormal psychology? Abnormal psychology is a branch of psychology that focuses on the study of abnormal behavior, thoughts, and emotions. It examines the causes, symptoms, and treatment of mental disorders and conditions that deviate from the norm. One of the key assumptions of abnormal psychology is that abnormal behavior, thoughts, and emotions are not necessarily pathological, but are a normal and expected part of the human experience. However, when these experiences become severe, persistent, and disruptive, they may be considered a mental disorder. Abnormal psychology is concerned with the classification and diagnosis of mental disorders. This involves the use of diagnostic tools such as the Diagnostic and Statistical Manual of Mental Disorders, or DSM, to identify and classify mental disorders based on their symptoms and characteristics. The DSM provides a standardized framework for the diagnosis of mental disorders and is used by mental health professionals around the world. The study of abnormal psychology also involves the examination of the causes and risk factors for mental disorders. This includes biological, psychological, and social factors that contribute to the development of mental disorders. For example, genetic factors may increase the risk for certain mental disorders such as schizophrenia or bipolar disorder, while environmental factors, such as childhood trauma, may also contribute to the development of mental disorders. Abnormal psychology also explores the treatment and management of mental disorders. This includes the use of psychotherapy, medication, and other interventions to address the symptoms of mental disorders and improve overall functioning. Treatment approaches may vary depending on the specific disorder and the individual's needs and preferences. One of the challenges of abnormal psychology is the stigma associated with mental illness. Mental disorders are often misunderstood and stigmatized, which can prevent individuals from seeking help and receiving appropriate treatment. Abnormal psychology seeks to reduce this stigma by increasing awareness and understanding of mental illness, and promoting positive attitudes and beliefs about mental health. Abnormal psychology is a broad field that encompasses a wide range of mental disorders and conditions. Some of the most common mental disorders include anxiety disorders, mood disorders, personality disorders, and psychotic disorders. Anxiety disorders involve excessive and persistent fear, worry, and anxiety that can interfere with daily functioning. These disorders include generalized anxiety disorder, panic disorder, phobias, and obsessive-compulsive disorder. Mood disorders involve disturbances in mood and emotions that can affect a person's ability to function. These disorders include depression, bipolar disorder, and seasonal affective disorder. Personality disorders involve long-standing patterns of behavior, thoughts, and emotions that deviate from cultural norms and cause distress or impairment. These disorders include borderline personality disorder, narcissistic personality disorder, and antisocial personality disorder. Psychotic disorders involve a loss of contact with reality, such as hallucinations, delusions, and disordered thinking. These disorders include schizophrenia, schizoaffective disorder, and delusional disorder. In conclusion, abnormal psychology is a branch of psychology that focuses on the study of abnormal behavior, thoughts, and emotions. It examines the causes, symptoms, and treatment of mental disorders and conditions that deviate from the norm. Abnormal psychology involves the classification and diagnosis of mental disorders, the examination of the causes and risk factors for mental disorders, and the treatment and management of mental disorders. It is a field that seeks to reduce the stigma associated with mental illness and promote positive attitudes and beliefs about mental health.